You rip open your first aid kit. Your hands are shaking. There's blood everywhere. Someone is screaming. You're fumbling through Band-Aids, antiseptic wipes, and tiny packets of ointment. You realize with horror that nothing in this box is going to save a life. The reality is brutal. Most first aid kits are designed for paper cuts and blisters. They're built by lawyers, not medics. When a real emergency hits, when someone is actually dying in front of you, half the items inside that red bag are worse than useless. They're a dangerous distraction. Today we're exposing the 5 items that people trust but shouldn't. Items that give false confidence. Items that waste precious seconds when every second counts. Stay with me until the end, because what you learn here could mean the difference between saving someone and watching them bleed out while you search for supplies that don't matter. Let's start with the item that's in every single kit but fails when you need it most. Adhesive bandages. Those little strips of plastic with a tiny gauze pad in the middle. We call them Band-Aids. They're everywhere. They're the symbol of first aid itself. But here's the truth that emergency room doctors know. In a real trauma situation, adhesive bandages are theatrical props. They do nothing. Imagine this scenario. Someone slices their arm on broken glass. The wound is deep. Blood is pulsing out with every heartbeat. You slap a Band-Aid on it. What happens? The blood soaks through in seconds. The adhesive fails because skin covered in blood doesn't stick to anything. The tiny pad is overwhelmed instantly. You're watching someone hemorrhage while holding a useless piece of decorative plastic. The psychology here is insidious. Band-Aids make you feel like you're helping. They give you something to do with your hands when panic sets in. But doing something ineffective is worse than doing nothing because it burns time and creates false security. In the minutes you waste applying and reapplying adhesive strips, a person can lose enough blood to go into shock. What actually stops bleeding? Pressure. Direct, sustained, aggressive pressure with whatever cloth you have. A t-shirt, a towel, your bare hands if that's all there is. You press down hard on the wound and you don't let go until paramedics arrive. That's it. That's the entire technique. No fancy supplies needed. Adhesive bandages belong in your desk drawer for minor scratches. They have no place in your trauma kit. Next up is something that sounds smart, something that makes people feel prepared and knowledgeable. Hydrogen peroxide, that bottle of liquid that fizzes and bubbles when you pour it on a cut. For decades, parents reached for this stuff automatically. The bubbling action looked like it was killing germs. It seemed scientific. But modern medicine has moved on, and most people haven't gotten the memo. Here's what actually happens when you dump hydrogen peroxide into an open wound. Yes, it kills bacteria. It also kills your own tissue. The chemical doesn't discriminate. It damages healthy cells trying to repair the injury. This slows healing and increases scarring. Wound care specialists have known this for years. The bubbling isn't cleaning, it's destruction. There's a second problem that's even more dangerous. In a serious emergency, cleaning the wound is not your priority. If someone has a deep laceration or a puncture wound, pouring antiseptic into it achieves nothing useful. You need to stop the bleeding first. You need to prevent shock. You need to get them to a hospital where a surgeon can properly clean and close the wound under controlled conditions. Spending 2 minutes sterilizing a gash while the person is losing blood is like rearranging deck chairs on the Titanic. But people do it because the kit contains the bottle, and the bottle has instructions. The kit becomes a script, and people follow scripts even when the script is wrong. If you want to actually clean a minor wound, use clean water. Tap water is fine. Rinse it thoroughly to remove dirt and debris. Then cover it with clean cloth and apply pressure if it's bleeding. Save the chemicals for later when there's time and when the injury is actually minor enough to care about sterilization. Hydrogen peroxide belongs in your bathroom cabinet for cleaning countertops, not in your emergency supplies. Which item in a standard first aid kit do you think is the most useless? Write your answer in the comments. Moving on to item number 3, elastic bandages. Those beige wraps for sprains. The package shows someone wrapping an ankle in a neat spiral. It looks professional, but in actual emergencies, elastic bandages cause more problems than they solve. The fundamental issue is tension. Wrap too loose, and it does nothing. The support is imaginary. Wrap too tight, and you cut off circulation. Within minutes, the foot turns pale, then blue. You've created an accidental tourniquet. Now you have 2 problems. Most people have never been trained on proper technique, When adrenaline is pumping, your fine motor skills disappear. You can't remember if you start at the toes or ankle. You can't judge tension. The result is sloppy and ineffective. But there's a darker truth. If the injury is severe enough to need immobilization, an elastic bandage won't cut it. A serious sprain can involve torn ligaments or fractures. Wrapping it in stretchy fabric is dangerous. What you need is rigid immobilization, a splint. You can make one from a rolled magazine and duct tape in 30 seconds. The injured joint cannot move. Emergency responders don't use elastic wraps in the field. They immobilize hard and fast. If the injury is minor enough for an elastic bandage, it's minor enough to wait, ice it, elevate it. If it's severe, immobilize properly and get to the hospital. The elastic bandage exists in a useless middle ground. If you're learning something that could save a life, hit that subscribe button and smash the like. This information doesn't go viral unless you help it spread. Now we get to item number 4, and this makes people angry. Antibiotic ointment. Those tubes of cream that promise to prevent infection. They're everywhere, and for serious trauma, they're irrelevant. Bacteria need hours to days to colonize a wound, not minutes. In the immediate aftermath of injury, infection is not the threat. Bleeding is the threat. Shock is the threat. Infection is a problem for tomorrow, assuming the person survives today. When someone has a major injury, you have one job. Keep them alive until professionals take over. Smearing ointment doesn't accomplish that. Here's the second issue. Antibiotic ointment is for superficial cuts. For deep wounds or puncture wounds, topical antibiotics are useless. The medication can't penetrate where bacteria grow. You need systemic antibiotics prescribed by a doctor. But the kit includes the tube, so people use it. They waste time that should be spent applying pressure or calling for help. If you want to prevent infection in a real emergency, stop the bleeding with pressure. Cover the wound with clean cloth. Get the person to medical care fast. Antibiotic ointment can wait. Finally, item number 5. Instant cold packs. Those plastic pouches you squeeze to activate a chemical reaction. They're supposed to reduce swelling and ease pain. Every sports team has them. But in life-threatening emergencies, they're a waste of space. An instant cold pack stays cold for maybe 15 minutes. Compare that to ice from a gas station or frozen vegetables from a kitchen. Those stay cold for hours and cost less. The instant pack is inferior, except for one thing. It doesn't require a freezer. But here's the reality of triage. If someone is seriously injured, cold therapy is so far down the priority list, it barely registers. You don't put ice on a chest wound. You don't worry about swelling when someone is bleeding out. Cold therapy is for after stabilization, after immediate threats are handled. The second problem is psychological. Having cold packs creates the illusion you're ready. You see someone hurt, you grab the pack, you feel competent, but you're treating symptoms instead of causes. Cold reduces swelling, but swelling doesn't kill people in the first hour. Hemorrhage kills, shock kills, airway obstruction kills. If you're in a situation where cold therapy helps, you have time to improvise. Fill a bag with snow. Use a cold soda can. These work just as well and don't take space in your kit. So, what should actually be in your kit? The unglamorous truth is that serious bleeding kills faster than anything else in trauma. You need gauze pads in large sizes, not the tiny squares in pre-packaged kits. Real gauze that you can pack into a wound. You need medical tape that sticks to wet skin. You need trauma shears to cut away clothing. You need a tourniquet if you're serious about preparation, a real one that stops arterial bleeding in seconds. Most kits don't include them because companies assume regular people won't learn to use them. That assumption costs lives. You need a space blanket to prevent shock. When someone loses blood, their body temperature drops. A metallized sheet weighs nothing and costs $2. You need gloves because blood on your hands means you'll slip and lose your grip when you need it most. The first aid kit industry sells you comfort. They package items that make you feel prepared without preparing you for reality. They include 20 Band-Aids and 1 gauze pad because Band-Aids are cheap. They include ointments and cold packs because those look medical on packaging. But they don't include tools that stop people from dying because those require training. A kit is just a box. Your knowledge saves lives. Learn to stop bleeding. Learn to recognize shock. Learn when to move someone and when to keep them still. These skills matter more than what's in your bag. The next time you see a first aid kit with cartoon characters on it, understand what it really is. a liability shield for the company, and false security for you. Don't trust the kit. Trust your training. In the first 5 minutes of a serious emergency, you don't need tweezers and safety pins. You need pressure, gauze, and courage to act. Which item in a standard first aid kit do you think is the most useless? Write your answer in the comments. And if this video changed how you think about emergency preparedness, subscribe so you don't miss the next one. Stay safe out there.